Hi, everybody. I want to welcome you in this afternoon to Coronavirus Inside the Arizona Numbers, where we take a closer look at the data coming out of our home state right here in Arizona. Obviously, this information can be applied to other states for better understanding. For some of you who are watching from other areas, let us know where you're watching from in the comments. And in a few minutes, let us know your questions as well. We'll help you find the data that you're looking for to make decisions for your life and your family. I'm Katie Raml alongside Garrett Archer right here, our data guru. Let's dive right into the numbers, first of all. And I know we have a few key things to talk about today, but as we always do, we'll start on that summary page. And of note today, we passed that 4,000 mark for deaths here in Arizona. And we always talk about the numbers, but we never cease to forget that there are friends and family and loved ones and neighbors that are behind these numbers, and that this is very real life for a lot of folks. And that 4,000 represents 4,000 Arizona families who are grieving right now. So we say that before we get started, but let's take a look at the summary page there today, Garrett.
Okay, let's just go right through it. So we are at 183,647 total confirmed cases. That's about 1,200 probable. The rest of them are confirmed. As you said, the number of deaths, we are above 4,000. You can see 216 of them still need epidemiological investigation, but they are comfortable enough to put it on the dashboard right now. So it's at 4,000. 1.2 million tests have been conducted, both diagnostic and antibody test. So, and let's go to today. So 1,444 tests were done, or cases were put in today, and that's 70 deaths. The PCR tests, 10,300 or so tests done today. The percent positive has gone down 1/10 of a point from 14.3 to 14.2. Any sort of movement with that cumulative number is very good. Think of that as sort of the battleship of the percent positives. It moves very slowly. And then the serology tests, 1,400 serology tests with a 5.4, which is where it was yesterday.
And we're going to talk about those percent positives a lot today. I know a lot of people have already either made decisions about their kids being in school, or the school district made decisions for you, and we're waiting for those metrics to come out from the state, and we expect that by Friday. So at the very latest, they have until tomorrow to get that information out to school districts. A lot of school districts, Garrett, as you know, already going ahead and pushing the date back farther into October. Many have pushed beyond Labor Day, and then many others pushing back beyond fall break, which we have in October here. So we'll talk about that as well. 5% is kind of the number that's been suggested by educators, and we've talked about that percentage point before, and what it would take to actually get to that in Arizona. There would be a few different ways for folks to calculate that, though, Garrett.
Yes, and it is very important to understand the different ways we see these percent positives, so that when the schools and the governor decide what metric they're going to use to open, you'll be able to interpret and see which one is they are using and which one some other places might be using. So we're going to start with the reported percent positives. These are the percent positives you'll see on Johns Hopkins University, on COVID tracking, on New York Times. These are the ones that are pulled from these summary numbers and then put into databases across the country with other states and compared around to other states. So there are, this is probably a good metric for a percent positive to figure out what's kind of sort of happening now. But I'd really use these more as a trend line rather than the actual date of occurrence. What we have been seeing lately with these numbers is that because our antibody percentages are going up so much, we are starting to see these numbers are inflated to what our true percent positives are in the state. So for example, right now I know COVID tracking, Johns Hopkins, a lot of these groups have us at about 16% positive for our sort of average, rolling average. But today, and I'll just pull this up really quick, today we reported a 14% positive using just the diagnostic test to the PCR tests, the cases to the PCR tests. We reported a 12.3 when you take all the tests together. And then when you try to take the tests, say, okay, now I'm just going to take only the PCR tests that are from the electronic reporting. So this is Sonora Quest, LabCorp, ASU, anybody who actually is reporting into the numbers and they're giving negatives. So this usually wouldn't include like hospitals and some other places that may not be reporting negatives to the AZDHS. And what we're seeing is we're seeing much lower percent positives with those numbers. Today we detected a less than 5% of those diagnostic numbers today, which is the lowest we've been for several months now. So now this is the reported percent positives. Now I'm trying to keep this a little less long-winded, but now I'm going to go really quick and show you where you can go to find the true percent positives. This is the percent positives, what actually does occur every single day on the epi curve, which is the actual date of occurrence of the test and collection of the test. It's in the laboratory testing dashboard. You come down here and there's these two charts. I'm going to keep them at weekly, but you can move them to daily if you'd like. But for our purposes, we're going to keep them for weekly right now. This chart represents the diagnostic percent positives, and you can see and they're done by week, and you can see our highest was the week of June 28th at a 21% positive. You can all remember that it was going up, and that's when there were lines. It was difficult finding a way to get a test, and you can see since then it's gone down dramatically. We're down to 11% this week. And right now, with not a lot of tests filled in, so there's still a lot of room for growth here, or it might even go down, is this 9% for this week right now. So there's also an argument to be made that while you're seeing 16% at COVID tracking and at Johns Hopkins University, when you're trying to figure out metrics of what's actually going on so that the schools can open, so other things can happen, this is a much better, reliable percent positive to use other than those reported percent positives, because there's a lot of noise in those percent positives, a lot of noise, especially now with our antibodies going up.
So Garrett, you think it is more likely that they would look at the week by week numbers instead of looking at the overall scope for the percentage of the pandemic?
I think they're going to make one or two decisions. They're either going to look at the week-by-week aggregates, what we're seeing right here, or they're going to take what's called a 7-day moving average of the daily numbers. Because when you're trying to do gating criteria and figuring out a percent positive or a case decrease over time, if you use absolute numbers, it can be very difficult. But because even one case could be represented as a case increase. So you go from 1,000 cases to 1,001 on a day, and you lose your gating criteria. You have to start over again. So when you do a 7-day rolling average, it sort of smooths it out. So if the next day doesn't show an increase, it would continue that gating decrease and sort of give you a better understanding of what's going on for 14 days. So those are sort of the two options that I can see them using: either a 7-day moving average of reported percent positives, or the actual epi curve week by week diagnostic test positives. I don't think they're going to use this. Obviously, you can see this is going up. This is the antibody test. This is showing more people that are taking these tests are having have already had the disease. So we're looking at we want to look at this PCR one.
So when we're looking at some of these numbers and we're comparing ourselves to other states, and we're hearing of other states now pushing back their school openings. I believe Chicago just made that decision yesterday or the day before, and we're seeing some of the other bigger cities. How do things look state by state? I know over on Johns Hopkins they were splitting that out in that direction so that we can see those same percentages and sort of see where we lie in all of this.
Yep, and we will we're bringing up a new website today for that. This is actually Johns Hopkins University. We're going to use their exact tracking numbers for this. So, and as you said, Katie, here is a place you can go. It's basically an overview, very easy to read overview of the percent positives by state. So right here, Arizona, it might be a little difficult to see. I'm going to try to darken my screen here to see if it makes it a little easier. And it is not, they actually have a blocker on that, so it will not.
It's okay if you're able to read some of those numbers. I know it can be small for so many of you. Oh, that helps a lot to see Arizona. Okay. I know people are watching on their phones, and this can make it difficult. And producer Josh has also added the exact web address for those of you who are interested on the bottom there. You can copy that over so you can go take a closer look at this website at your leisure, and maybe even compare it to your home state or a state you have to visit. Or as we've heard from parents on here, their kids or family live in other states. There's someone who joins us on here many afternoons. His kids live here in Arizona, and he lives in another state, and he watches this to sort of track what's going to be happening for his family who lives here. So this can be a helpful site for that. So we'll keep that web address up there for all of you.
So this is the percentage positives testing tracker for every state. So you can go through all of them to see what's going on. You can rank them in order. So if you push this button right here, it will show that's actually the most. There we go. You can see sort of how things are looking from the worst percent positive to the best percent positive. Mississippi having a 22.1% positive. And then going down here, you can see ours is still pretty high up here at 16.6%. But again, with what I just told you on this reported number, Johns Hopkins University is using these reported numbers. We're showing a very high reported number right now, but we also have a lot of antibody tests that are in the system. So it gives us a higher percent positive than what we actually have. So, this is why I'm a little skeptical on this 16.6% right now. I'm not really buying it. But it's what these groups can take from the website. So this is what they have. So you can also take this and look at regions. Let's do it by region. This is great. You can look and do right here, filter by region. You can see what it looks like in all of the Western states. You can see Nevada is still posting a 20.8% positive. Ours is 16.6. Hawaii at 5.6. California at 5.5. Now, with a disclaimer on this, just like Arizona, I do not have knowledge of how these other states are reporting their tests. So there could be instances in which, say, for example, Nevada is reporting their data similar to us, and that's why they have a high percent positive. But California is breaking out their diagnostic tests only, and they're not putting in serology tests, and so thus would be showing us a lower number. I don't know how all of these states do it. It's one of those kind of sort of idiosyncrasies of this whole thing, is trying to figure out how these data really do compare to each other. But this is, you also have a map here, which is nice. Let's see if I can get to the map overview. I'll bring it back here so you can see it. I'll go to the percent positive, and you sort of see right here that the region, the Northeast region, has the lowest percent positives in the country. Here in the South, sort of the Sun Belt, which we already figured out, the Sun Belt was where most of the high increases have been. That most of those states are still having problems with their percent positive.
So we're spending obviously a lot of time on the percent positive today because it's become such an important tracker in sort of trying to figure out what's going to happen with schools. And obviously it's encouraging if we can see some lower percentage numbers coming out of Arizona, even if it's not reflected in this overall or this 7-day rolling average that we're seeing here on Johns Hopkins. So some of the ways to track that, you would say the easiest for folks who want to look this up on a daily basis is to go to that lab section of the AZDHS site.
Yeah, that's the best way to track our specific true percent positive, is going to the lab site on the AZDHS. These sort of Johns Hopkins sites and all these other comparisons, they're very good for looking at trends. So I do want to make that clear, even though I do believe that the 16.6% is too high, and it's probably not reflective of what our percent positive is. In fact, I know it's not reflective of what our percent positive is. It's still the trend is still important. So if even
right.
at inflated number, if it starts to increase, these will detect that.
Garrett, how long, what would you say the range would be to even get to a 5% on any of those higher numbers here in Arizona? Is this something that takes months, weeks, days?
Honestly, I don't know. With this number, I don't know if we're ever going to get to 5%, simply because of if we continue to have increased antibody percentages. Right now, our antibody cumulative is 5.4%. That's already over 5%. So I don't see us getting to a point where, unless we have a very large number of PCR tests coming out, which we don't have the testing demand right now to have a large amount of PCR tests. So without that large sort of PCR test number coming out to water down the antibody positives, it could take a very long time for the daily reported percent to get to under 5%. That's why you want to look at that, the PCR test, the COVID-19 tests, laboratory test from AZDHS. That's the one you want to focus on, because that PCR test, that could very well go under 5 within the next less than a month or so. I mean, I kind of think it's going to take about 3 to 4 weeks for it to show up as under 5%, but it's definitely sort of in the realm of possibility at this point.
It's interesting because it has no bearing on how quickly it climbed. It has no, it's not reflective of that. It's not going to trend down, step down at the same speed that it ramped up to get us to this high percentage point. So there's just no way to know at this point, and we're just going to have to kind of ride this out as we wait for information from schools and then see how long it goes beyond that, because a lot of people have said that you know, it'll be 2 weeks sustained and then at least another week before they can let parents know that they would be called back to the schools, and to let teachers know that they'd be called back into the buildings themselves. Yeah,
and again, it will take at least 2 weeks. If you use the epi curves, the actual dates, it takes 2 weeks for them to settle. So now you're looking at an additional 2 weeks just to get the rates that you can use to determine a 2-week downward trend. Right. And then, like you said, another week for it to notify parents. But that's if you use the epi curves, because that's just the way it has to be. It takes at least 2 weeks for them to stabilize.
Right. So it makes sense that so many school districts were able to say, we're not coming back till October, and this is not even a discussion until then. All right. I do want to get to some of the questions in just a moment. I want to remind folks, this is only a discussion on data surrounding coronavirus. I'm seeing a lot of other comments in here about a ton of other topics, and we have many of these different discussions throughout our day parts here on ABC 15 about a wide range of topics, but that this one is only about data for coronavirus. So if there's a number that we can help you look up or we can help you find, we are happy to help you do that. In the meantime, Garrett, I want to get to some of the hospitalization numbers. Thankfully, it has not been as much of an issue, but it's still something we want to keep everybody updated on from day to day as we track it. And I know we're going to get questions about our R-naught as well. That might be something to definitely be able to celebrate today. We'll do the hospital numbers first as you have them pulled up. And these are reported to us pretty close to real time, as close as it gets to real time.
Yes. This is a bed count done by the hospitals in the state every single night, and then reported. So this is a really good indicator of what we have. I will bring them up. I'm going to stay with the hospital COVID-19 specific metrics. You can see a continued decline since our heights in the this is the inpatient, so the general bed care. We're 1879. I believe that's the lowest number we've had since late June, June 21st, I believe. Ventilator use also has gone down, 427 again, June. That's how long it's been. ICU 593, under 600 for the first time since June 20th. COVID-19 discharge did go up. This one is, you actually do want to kind of see this one go up as well. But again, as a caveat in this is obviously people who are released from the bed, so they could be considered quote unquote a proxy for recovery, but this could also in this definition be a death. So you have to look at that 309 as a combination of people who left the hospital because they were discharged and people who died. That's just a fact of the definition of what they're using here. The COVID-19 emergency department, you could see this line has slowed. It's still going down, but the decreases have definitely, the descent has slowed. It's now sort of in a curving motion rather than just a downward motion. That's something to sort of watch. Emergency department numbers are one of our best leading indicators of what's going on out there. So this could be an indicator that we might be seeing a floor in hospital visits coming up soon, where we're not going to see this downward trend going down as much as we have been seeing it. It might start. It'll still go down. It could still go down, but it may slow its descent. And then intubations, which is the fitting of a ventilator, that's stayed the same as yesterday.
Garrett, thank you. Some of the questions that are coming in, Michelle just asked about Governor Ducey and Dr. Kara Christ, whether they would be speaking today. Oftentimes, Michelle's right, cute picture there, Michelle. Oftentimes we hear a lot about them speaking on Thursday afternoons, and usually we're rushed to get through all of our numbers here, Garrett, as we make room for them to speak. Doug Ducey is actually in Washington. He's in D.C., so he will not be speaking this afternoon. You might have seen our coverage from the White House yesterday. He was there meeting with President Trump, and there are no plans to be speaking today. What there are plans for by tomorrow, we are expected to hear about the plans for schools. So that's what we'll be anxiously waiting for. As soon as we know anything more about the plans for schools coming from the state, we'll pass that along. And if we hear anything more about the parameters for how gyms can apply to reopen, we will pass that along to you as well. But I wanted to update Michelle's question there. Michelle, thank you for the question on that. Jeremy was also asking about false positives. And Jeremy, if somebody has a case of thinking that their information that they're getting is wrong, they need to call their doctor. We don't have any reports of that here in Arizona, but you do put your phone number in when you're signing up for your test. And as always, you could mistype your phone number and that would cause somebody else to get a phone call. Perhaps they never even went to get tested. So that is the only reason the county is saying something like that could happen was like a data entry thing with your phone number. Remember that you are tracked by your name and date of birth, just as you would be a medical record. So we have not heard cases of that.
I will say, though, that he's not entirely wrong, that there is going to be a margin of error in any test. So there can be cases that are actually in the system as cases that are false positives. But my understanding is the margin of error is very low on these tests. So we're talking maybe 1% to 2% of the cases that we're showing could technically be false positive. So that is just the reality of tests and the way that things work in the medical community. Yeah,
and we have not had any widespread cases of that here. On the East Coast, Garrett, you remember that there was like 90 in one particular senior living center that there was something wrong with those tests, but we haven't had any massive.
No, that was very early on. The FDA had some issues with tests at that time, but that's all been resolved by this point.
Yeah. So if Jeremy has a friend, reach out to us, because that's have the friend reach out to us, not you and the hearsay and all of that. Janine writes, how is the delay of getting test results shown in the data?
That's a great question. There is very little delay now. So we're looking at the sort of standard lags now. We're looking at anywhere from the day, the next, tomorrow, I can't speak today, from yesterday to about 7 days is what we're seeing right now in the data for the cases and tests. And that's pretty standard. That's really not going to change. I don't see, just because this is all an investigative process, I don't think they're going to get to the point where they're going to be, oh, we got this in 48 hours. It usually takes them about 7 days to make sure that all the details, all the I's are dotted and the T's are crossed. The death curve does take a little longer, usually about anywhere from 12 to 18 days. And then the hospitalization curve, that one sort of varies. It can be fairly recent, but then we're noticing that they're starting to do these really large dumps on Tuesdays and Thursdays of hospital data that basically fills in what they missed from the last couple days. So, it's one of those things where I don't really use the hospital curve that much because it just moves too fast.
Yeah. Let's see. Lisa was asking how much testing is being performed. I think we had 11,000 to 12,000 results come in yesterday.
Yes, and we do have, so for this last week, so anything after August 2nd, we have about 14,000 tests that have been conducted after August 2nd, so in the last 4 days. Last week, it was about 51,000 diagnostic tests.
And overall for tests, we're still at about 1.2 million. Is that sort of the range we were in?
1.2 million, including serology tests, yes.
Yeah, and that's for Arizona, Lisa. Thank you for the question. Lee now asks, have they completed the backlog yet? It looks to be so, Garrett.
Yes, they've completed it.
The deadline to get that done was last Friday, and they sort of got it done over the weekend, and then we had our sort up reporting by Monday and Tuesday. So that should be fixed up by now. Hey, let's get to the R-naught number, because we do have we're close, man. tenth of 1 point away. I believe we're like at what was it, 0.63 to 1.01.
Well,
we're at the front of that line right now.
Yeah, and absolutely, right now we have the best R-naught in the country. So we are at 0.86. Sorry, it was rendering kind of weird there, but we have the best in the country right now at 0.86. And I'll try to see, this one should be able to darken. So let me try this really quick. It does. Okay, so the green is the under 1, and the sort of pinkish color, now that I've darkened it, is the over 1. And you can see here's Arizona at 0.86, and the range, the error bars, which is so important when you're looking at an estimate. It's now just to the point where it's going to be under 1. And if you've got a 0.63 to a 1.01. So what that means is the estimate is saying we really at this point don't believe that this virus is spreading as fast in the community, because the way just to understand the R-naught number for everyone, that 1.01, that means that, or I'll just go with the 0.86. So that means if 100 people have COVID-19, then they are able to transmit the virus to 86 people. So at our highest range right now, what they're saying is 100 people can transmit the virus to 101 people. That obviously means that the virus is growing, but that's why you want that number under 1, because then it's not growing in a sort of upward direction. It's still over time going to fall. And we're almost at the point where the R-naught in Arizona is saying that no matter what, if 100 people get it, they cannot transmit it to another 100 people.
Right. So Stephen Daniels is asking, does that mean that 100 people could infect 86? That it does.
That is the best sort of.
Yeah.
That's the best definition. That's the simplest definition of the R-naught, is that 100 people could infect 86 people.
Yeah. Good job, Stephen. Stephen joins us on here a lot. So love that you're able to sum it up like that. Carol asks, can you explain again how the R-naught interacts with the percent positive?
It doesn't. It actually interacts with the case numbers. That's the most important on the R-naught estimate, is the case numbers. So they're doing sort of probability estimates based on the case numbers and the number of tests. So in reality, it does sort of factor in the percent positive, but really the number of cases that are coming in is more important to that number.
Yeah, and Carol, we always say, remember, the R-naught doesn't care what the outcome is. So it's just callous that way. It doesn't care if you go to the hospital or if you don't survive. This is just related to the case count. Sherry's asking an interesting question on this. How can we have the best R-naught and the worst positive case number? I think she might mean positive case percentage, right?
So, and that's exactly what I was talking about at the beginning of this Facebook Live, is that the percent positive case numbers we're getting are inflated. We know they're inflated because we know that antibody tests are being included in the data that AZDHS is putting out. So that 16.6%, we know that that's inflated. And that's why, that's exactly why we would have sort of a very low R-naught and also a very high percent positive.
And so would that then, Garrett, do you think make it more important to at least peek at how our weekly percent positive or even daily percent positive, if you're watching it on a daily basis, you're checking it every day, to see that leading indicator, like that's the direction we're going. Although we sit here right now, this is a good direction. This is the way we're going.
That's exactly right, because as we've talked about before, the R-naught doesn't, it's not a daily report. This curve is recalculated from top to bottom every single day. You'll see this and be like, this number back here on May 26th could very well change at some point, because the R-naught is a reflection of the entire pandemic, the transmission, not just what's happening right now. So that's sort of why this curve is recalculated. But again, if you want to see what's going on a day-to-day basis, it's always good to look at the percent positives and really the trend in the percent positives, not just the day. If we have one day, I mean, right now, for example, I know that college students are being tested so that they can go back to school. That could be, that's just one instance in which could be giving us a lower percent positive or a lower PCR percent positive right now, is because we're getting an over sort of sampling of these college students that did not, we're not coming into contact or whatever, coming from different places in the community. They're not coming from Arizona. They may have just moved here and they're getting a test. So there's just so many variables
Mhm.
on what that could be one of the reasons why we're seeing something so low right now. And then over the next week or so, it sort of levels off a little bit. I don't know. I'm just saying that that's a possibility of what could happen.
Yeah, and it's one of the things we'll keep walking everybody through on here as we track the numbers. That's why it's so fascinating to look at these numbers every single day. Hey, Micah's asking, how many active cases are you estimating based on the amount of days they are infected? So, Micah, thanks for joining us on here again. So, one of the ways we kind of look at things is to see how long you've been infected, 14 days and then 28 days, and pulling up the numbers based on that so we can kind of get a better idea of how this affects our community.
Yeah, because of the people, of the 180,000 that have been confirmed positive, it's really only those cases that are within 14 to 28 days, someone like prior to 28 days of infection that have the ability to transmit the virus. Someone who had the virus back in June does not have the ability to transmit the virus anymore. So in most cases, of course, there can be outliers, but this is talking about most cases. So what I have for active estimates right now, I have about 16,700 cases that are under 14 days old, and about 52,000 cases that are under 28 days. So at a best case scenario, only 16,800 people can transmit the virus in Arizona. And at a worst case, if you will, about 52,000 people could transmit the virus.
So Micah, thanks for the question and thanks for joining us on here again. Someone was asking, let's see, Hannah was talking about an increase in suicides from being in quarantine. We do know that Teen Lifeline, one of the really wonderful places here that takes calls, peer-to-peer counseling that takes calls from teenagers, has seen a 6% increase, but we don't have numbers specifically related to suicide at this point. If once we do, and this is something that we've reported on for years and years, it has been an area of focus for us here at ABC 15. We will continue to bring that as well. Let's see some of the other numbers that you saw today. And I want to remind people too, if you're interested in getting a test, that as we've mentioned, the test lines are a lot shorter and it's easier to get in for a test now. So if you're just curious, you can go get a test. And the site to figure out where to go and how to sign up is doineedacOVID19test.com. Producer Josh popping that website up for us really quickly there. Thank you, Josh. doineedacOVID19test.com. That'll give you all the information on both saliva tests and the nasal tests and antibody tests. And as always, if you're interested in a free antibody test, they do that through Vitalant and Red Cross. So if you are able to donate blood, that is just one of the ways that you could get free information on whether you have antibodies in your system through those two places. You can go to their websites and they have plenty of blood drives all across the valley that you can sign up for and get a little more information about your own health at the same time as you work to save somebody else's life.
So I saw someone say really quick, I apologize. Someone say that, we don't like.
Oh, and I think Garrett, you might have froze there. It might be me frozen or it might be.
Am I back?
Oh, we're both frozen. Okay, we're back.
Okay, we're
just
back.
Just a little minute there. Sorry about that. We're back.
Sure.
We're back.
So I did. One of the comments I saw was that the media doesn't like to report the death numbers from year to year because it doesn't fit a narrative. And I am more than happy to share death numbers for Arizona from January to June. And so what I'm going to tell you is I basically took all of the vital statistics from AZDHS and just took only for the years for January to June so that I can match them up properly to 2020. So what we see, and of course there is increases every single year because of population increases. But typically death increases during that time sort of stick around at anywhere from 5 to 6%. And this is from 2010 on. And this last year so far, we're up 13%. So
Garrett, you're saying every year we grow 5 to 6% in
not every year. Sometimes we don't grow at all. Like for example, between 2016 and 2017, there was no growth. In fact, it was slightly negative. We had 29,397 deaths in 2016. During this time period from January to June. 2017, we had 29,198. So that's less than a 1% decrease. So barely a blip. I mean, it's essentially just it's about 199 death difference. In 2019, 30,522 people died in Arizona from January to June. And then this last year, 2020, 34,457 people have died. That is a 12.9% increase for that same period. So that is phenomenally higher than what we've seen since the everything else we have. I have a chart for that I'm going to bring up here. I'm just trying to get it up just to sort of show what it looks like just really quick. Here's what the chart looks like. And you can see that deaths have increased from months through June every single year, but you can see there's some slight decreases here, you know, jump 5 to 6%. And then here's 2019 to 20, which is a much more significant jump than any of the others. So, you know,
so we can't see the bottom of your bar right there because of our,
of course. Let me see if I make it,
yeah, I'm assuming each one of those squares is year to year or summer to summer as we look
there we go. You see
now we can see it. Fabulous.
Okay.
Thank you so much to help everybody. Thank you.
So this shows. So this is just because I know some people are saying that, well, you know, deaths are these deaths would have occurred in a normal period at any given time. It's just that they're being assigned COVID deaths, and that there no real additional deaths have occurred in Arizona, and that's just simply not the case. We do have excessive deaths this year. Whether you know, what's going to be difficult to calculate is what that excess truly is, but there has been an excess of deaths. That is not disputable at this point.
And are these year to year, or they're only the first half of the year, January to June?
Half of the year. So this is January to June in all of these. June is the most recent data we have. So that's why we're going with June until AZDHS releases the July numbers, which, because we had very high numbers in July, I expect they're going to be a significant increase when I add them. You look at sort of the standard curve for deaths in Arizona over the last 10 years, it's sort of a it goes down in the summertime, then starts to increase in the fall again. And this year, that is not what the curve looks like. It's going up. So I'm pretty sure once the data releases that we will see an increased number there. But again, I don't know what it is yet. I'm sure that based on what we've seen, it's going to go up.
Yeah, and then sadly also having to consider such a hot summer. We have just had no relief, and we know that is so dangerous for so many folks in our community as well. I want to remind people, if there's reporting that you're looking for on the coronavirus, you can find that on abc15.com/coronavirus. It has all of our reporting right there on this topic and the issues and families that we have covered every single day since we started reporting on it. I believe it was January 17th, the first time I had to read about a mystery illness out there. We didn't even really know what it was at that point, and that was the safest and best way to describe it before it sort of had a name. So it's been a long time, a lot of heartache.
I saw Lisa ask if our cases are going down because our tests are going down. She just asked that question a few minutes ago, and the answer is yes. Obviously, our cases are going down because the testing is going down. However, it appears very much that this is due to demand. We're no longer in a situation where Sonora Quest cannot keep up with the demand. We have no lines at the testing sites, so you know, we just simply do not have the demand right now. You know, whether that changes when guidelines get put in place, where you know when the state decides to start opening up mobility, if they're going to have testing criteria that's going to increase capacity over time or increase the demand over time, that might occur. But right now, with none of those in place, none of those sort of regulations in place, we just don't have the demand right now. So yes, cases are going down because of testing, but you know, that just seems to be the natural way of things at this very moment.
Yeah, twofold, I guess. We want to remind all of you, some of you are saying this virus is no big deal. It doesn't matter at all. It doesn't affect my life. If it doesn't, you could be a part of the change. You could be a part of clinical trials and helping everybody get to a place where they feel safe going out once again, and that they can protect their own health and their own lives. If you'd like to sign up for those, there are 2 that are now happening here in Arizona. So a lot of eyes on Arizona and how this is going to work out. One has just started, that is the Hope Research Institute trial. HRIAZ.com is the place where you could sign up for that. And also cctresearch.com. They're just getting started in the works of getting that trial started here. So if you don't have luck with HRI, the Hope Research Institute, you can try this second web address right there. And so you can be a part of the change. If you know, there's a lot of brave people out there who can go be a part of this and help get us back to what seems to be closer to normal. We certainly hope. It's been a long time. Where can we find those zip code numbers? Oh, your comment just went by. Debbie Manley writes, where do we or can we find out the numbers from state and federal prisons in a particular zip code? Even more specific. Are we able to help Debbie outside of just pulling, gosh, I'm trying to think, like what we saw down in Tucson, we just had, hundreds reported there, and they've separated that whole group from the general population of that prison. But would that then be reported?
So I do have a dashboard. We don't share this that often, but we do have it up. I believe, producer Josh, it's in there. It's corrections.az.gov, ADCRR-COVID-19 dashboard. This is, and I'll just put this in here so that you can see it. This is basically the Department of Corrections COVID-19 dashboard. They do not update this every single day, so I tend to lapse on checking it. But as far as the zip codes themselves do not, when you look at the zip code map the AZDHS puts out, it does not sort of say these are from prisons, these are from community settings. It doesn't say that. It just gives the case number. So this is the best place to go to see what the corrections department has for its COVID-19. So you can see about 600 staff reported positive, 508 have been considered recovered. I don't have the totals right now because I can't, let's see, what are the totals here? Here they are. So inmates tested, 8411, inmates negative, 1653, inmates confirmed, 1429, recovered is 444. So they're sort of what, we're looking at about 1,000 inmates in Arizona that are active with COVID-19 at this point.
Wow, that's a helpful site. Thank you, Garrett, for that. Is that just for Arizona, or is that?
This is the Arizona Department of Corrections dashboard. Yes, this is just for Arizona.
I wonder if other states have something similar to that they're putting out their information as well. Interesting. Let's see. So people have asked about Governor Ducey speaking today. He will not be speaking today. He is at the White House. I know we covered that a little bit earlier, but I saw a few questions. So Vicki, I wanted to get your question answered as well as some other people who have written in. Garrett, Debbie says, thank you for that information. Debbie, thank you for the thoughtful question. Let's see. Amanda writes, is there anywhere to find reliable cases per week number? So split week by week, I think is what she's asking for the cases. So I'm assuming, Amanda, that you would like to see the growth over time, or the as the growth starts to fall. Is that?
Tell you what, Amanda, I'll try to have that by Monday. It's been on my to-do list. And I haven't finished it yet. So I'll put that on my to-do list. I'll try to get it up on Monday, and I'll get you that weekly sort of case growth numbers in chart form next week.
Garrett, you're too good to us. Thank you. Samson asks, how come they're always wearing their pajamas? We're not in our pajamas. We are in our homes. We are reporting from our homes. They have really only, gosh, Garrett, when was the last time you were in ABC 15 studios?
March 14th.
Yeah. And I'm there just 2 days a week. We're dressed. Don't worry. I wish we were in our pajamas all the time.
I will answer. So I see Ryan Clandening asking how much monetary incentive do hospitals receive for reporting coronavirus cases. I actually did a sort of a myth bust on this last week. We put up a report on this specific point that Ryan's making. So how that actually works out is that it's not that they do not have any monetary incentive to report a COVID-19 case, but what they do is CMS, based on the Federal CARES Act, CMS does have certain appropriations that are given for treatment of COVID-19, specifically for Medicare treatment of COVID-19, and there has been estimates done where it can be, I believe, $13,000 for just sort of standard treatment of care, and then that can go all the way up into like $50,000 for someone who has to go all the way into ICU and ventilator. So yes, there is money set aside by the Federal CARES Act for Medicare patients and the uninsured that the hospitals need to do treatment. However, With this being said, there is no indication in any of the data, or there's no incentive for a hospital or a doctor to code a COVID-19 death that is not otherwise a COVID-19 death. If for some reason someone has a treatment chart that has no COVID-19 in it, and then all of a sudden, someone came in for a heart condition, and all of a sudden the doctor says, well, COVID-19, and marks it in as a death, that will be looked at by the office, the Inspector General's office. There are lots of sort of check gates to make sure.
Balances, yeah.
Yeah, there's checks and balances to make sure that that sort of upcoding doesn't occur. Has it occurred? Can it occur? Of course, there's got to be an example somewhere in the country where someone has been upcoded. Obviously, we've seen reports where there's been either mistakes or deliberate upcoding, but that doesn't mean that it's pervasive. So there is not a situation in which doctors are upcoding hospitals at the time of death, especially saying this is COVID, oh, this was a COVID-19 death, now we can get money. In fact, most doctors, attendant physicians that have to sign the death certificates, they don't have financial incentive from the hospital anyway. It's not like they get a bounty from the hospital for putting up a COVID-19 death. So, and most doctors, frankly, when the ones I've talked to said they'd be, they're insulted that the suggestion that they would just upcode for benefit of the hospital. So that's just something to think. I know that rumor's been going on a lot, but I can tell you just by talking to some people and just by basic processing and how it works, it's really, there's really no truth to it. As I said, it could occur, but as far as it being pervasive, that's very, very, very likely not.
Yeah, they take an oath. These doctors take an oath, and yeah, they do take it personal when this kind of stuff is said. I can't imagine working all day to save lives and then hopping on the internet and seeing things like that written about your profession. It's let me.
Yeah, and see, Anastasia Andrade is backing me up. In that Facebook post, she's saying that no hospital would risk their Medicare license by upcoding, and that's exactly right. The Office of Inspector General, if they catch upcoding, they're going to pull licenses from hospitals. And that's such a massive source of revenue for most hospitals. They would not want to see their Medicare licenses being pulled.
Yeah, thank you for clearing that up. I know we see a lot of things on here that we see a lot of things on the internet everywhere that take a lot of patience to clear all up. I think that's where we have to wrap up today. I did see a few more questions. We'll try to get to some of you or hold on to them for the next couple sessions that we're having. We're already up against the end of the week, and tomorrow is Friday already. So we'll be back here with you for Friday. We don't catch up with you on the weekends, but we do have Garrett, you always update your Twitter account on the weekends on your days off, which is so very kind. And you guys can find him at @Garrett_Archer. And my Twitter handle is @Katie Raml. And I appreciate, and I know Garrett does too, all of you that have joined us over there as well to continue this conversation. Garrett, you break down some of the numbers that we always talk about on here, and then some of the other sort of I'll use the phrase hot topic numbers, the numbers that are of interest for us that particular week or that day, some of the things that we have a little more time to talk about on here. And as always, our very latest reporting on ABC 15 at 4, 5, 6, and 10 p.m. We'll be there, not in our pajamas, for you with the very latest coronavirus information. And you can find our website at abc15.com/coronavirus for all the very latest reporting as well. We want to thank all of you who have taken the time and shared some thoughtful questions with us and gotten involved with the conversation here. We think it's important to help you understand the numbers. We are absolutely not here to make decisions for your life. We are here to show you where to find the data so that you can make the best choices for your family and your health. You know your life best. We're just happy to guide you through the numbers and websites that we stare at all day, every day to help streamline your process as you hop online. So thanks for taking time with us this afternoon. We'll see you back here tomorrow about the same time and same place. Garrett, thank you. And we'll see you tonight at 4, 5, 6, and 10.